you are part of a team and he was part of my team, we can say, oh, I've seen this before, or I know who you can go to, and you can refer. Whereas if you just work in isolation and so on, it wouldn't have been, she would have, she would have just resigned to the fact that she had to live with this adult and pay for the rest of her life. Okay, so the question, what are your views on the American Hernia Society suggesting introducing an extra area specialty for complex hernia repairs? Well, I think it's great for multiple reasons. One is it justifies the fact that there are specialists among us who are real, and we're not just using hernia as a marketing ploy. There are literally centers around me that call themselves the Hernia Center. And in the same office, if you Google them, they're also a gallbladder center. They're also a plastic surgery center. Like, it's crazy. Like, well, what are you? Are you just a specialist in all of these? Or are you just a general surgeon that provides all these services and you're using those as marketing tools to grab the attention of Google searchers? Also, usually, when you have a designation of a specialty, it comes with minimum requirements. Right now, there's no minimum requirement for anyone to call themselves a hernia specialist or a hernia doctor or anything, because it's considered all part of general surgery. And therefore, what can happen is anyone can call themselves. In fact, one of my patients is going to go see a doctor, and he said, on their website, he claims to have done 2,000 or 20,000 hernia repairs. I think 2,000, which is a lot, but fine. And in his website, he says he has the best outcome of any surgeon in the entire United States. Okay. How did they come up with that? And how is it? I don't know who this person is. I mean, I know everyone that is in the hernia world. How do I not know the best hernia surgeon in the world? You would think I would know them, being in the hernia world. So there's no accountability, like, based on what? Whereas, if you do develop a specialty for complex hernia repairs, there's a minimum requirement. You have to see this many patients. You have to have a team, and they'll define the team. You have to have a pain doctor. You have to have whatever. They're going to come up with a team, and then they're going to say you need to see this many patients of this variety. You have to be able to offer laparoscopic, robotic, open tissue, non-tissue. They'll come up with some type of requirement. You have to follow your outcomes, and your outcomes have to fall in a certain category. You can't just say you're the best doctor in the world without backing it up with data. You have to do research. You have to present it at meetings, etc. So this is actually a great question, because I talked about earlier about cancer and transplant. They are both specialties, and they both are heavily team-based approaches, and you can't have a cancer center or a transplant center without meeting certain requirements. And we don't have that right now for hernias. And I'm hopeful that the same way a cancer center has to have a research team, a nursing team, various specialists in oncology, whether it's medical, radiation, surgical, and they have to follow their outcomes, and they have to follow their patients like for life. A similar thing will hopefully happen with hernias, where patients where doctors are then held accountable for this designation of complex hernia repair. Like, I think I'm a hernia specialist. Most people consider me a hernia specialist. I don't really have like haters and be like, she's not a specialist, because I do offer all those options. But even within our hierarchy, like, some people think they're better than others, and that's just like the surgical ego. But if you actually develop a hernia specialty designation that you can apply for or fall into, there's a minimum. So, for example, the European Board of Surgery has a abdominal reconstruction specialty that you can. It's like you have to be able to provide your caseload to show you do so many cases, and then you have to do like a formal exam and pass it at a certain level, and then you have to have an oral questionnaire section. Every year when I go to the European Hernia Society, I participate on the oral boards part of it, and that's because I have that designation. I am boarded by the European Board of Surgery. I'm a fellow of the European Board of Surgery in the abdominal wall reconstruction level. It's kind of what they do in Europe. We don't have that in the United States. We just have American Board of Surgery. So I am board certified in general surgery, but there's no separate hernia designation. So I'm really excited because there was discussion about that. It doesn't mean you can't do hernias as a general surgeon. You just don't have the additional designation for complex hernia repairs, and therefore, hopefully, what that implies is that when you as a patient go to see a doctor and you have a complex hernia, and that will be defined. Usually it's like loss of domain, multiply recurrent, mesh complications, nerve complications, maybe morbidly obese, then maybe don't go to a general surgeon, go to one of these doctors that are taking the time, effort, and care to get that complex hernia specialty designation. On that note, let's finish up today's Hernia Talk Live. Thanks, everyone.